Welcome to a discussion on patients with cancer. The term cancer refers to a group of diseases that characteristically grow in an uncontrolled manner with the spread of abnormal cells. And they say that if all the cancers that are detectable early were diagnosed in localized early stages, we would have a 5-year survival rate on cancer of 95%. This chapter is big on new terminology. Please make sure and look at your vocabulary. Don't come back later and tell me we don't teach you vocabulary. It's right there in your book. All these words are listed in black in the text. The first one is neoplasm. Neo means new. Plasm refers to the abnormal replication of cells. Cancer is where the new cells are starting to grow very, very quickly in places where they're not supposed to be. So a benign neoplasm is a cancer growth that is usually harmless. It's usually almost always encapsulated. That means it's surrounded by a capsule. The capsule prevents the release of cells and restricts their spread to the other parts of the body. Benign means it's not as serious. This benign neoplasm can create problems if they press against and interfere with the normal structure and function of your nearby organs. So the term malignant neoplasm is when the plasma cells, the cancer cells, go and they change a cell's DNA makeup and function. Remember, cancer cells do not look or behave like normal cells. There's a nucleus inside those cells. They're large and irregular. They fail to follow the rules that regulate the reproduction of normal cells. They do not seem to know when to stop multiplying. The offspring of cancer cells, they end up proliferating, which means multiply in great numbers. Metastasis is a term that refers to the movement of the cancer cells from the original cancer site to the other areas of the body. Now, not all malignant cells will metastasize. The great majority of the malignant cells do. Prognosis. A prognosis for a patient depends on how much the malignant cells have attacked body tissues. The term in situ is Latin for in place or in position. So in medicine, it also means localized. The term is used in surgery cases and cancer diagnosis and treatment. When you give nursing care to cancer patients, you're going to see something called TNM staging system. And so what this is, the T is a letter to describe the original primary tumor. N tells whether the cancer has spread to nearby lymph nodes, and M tells whether the cancer has spread or metastasized to distant parts of the body. So if you see T1, N0, M0, it would mean the tumor is small and localized, no involvement of the regional lymph nodes, and no metastasis. If you saw T1, N2, and M1, it would indicate a small tumor with moderate regional involvement that has metastasized to one distant site or organ. Some information for you to keep in mind. Cigarette smoking is linked to cancer of the lung and is thought to be linked to esophageal, pancreatic, bladder, and kidney cancers, and we want to encourage those who smoke to quit. 90% of lung cancers in men and 79% in women is related to smoking, and use of tobacco along with the intake of alcohol is related to several other types of cancer. Another important thing for you to keep in mind is the term promoters. Promoters are not carcinogenic when they're found alone, but when they're in the body with a known carcinogen, cancer can occur faster. Alcohol is a big promoter. If nicotine is present, cancer will occur at a faster rate in those who are heavy consumers of alcohol. And it's thought that about 90% of all head and neck cancers are tobacco and alcohol related. There are physical carcinogens, one being radiation. Now, radiation can come from an X-ray machine, radioactive elements, or UV rays from the sun. They can penetrate certain body tissues and cause the development of malignant cells. So think about the sun. The UV rays of the sun produce skin cancer. There is a deterioration of the Earth's ozone layer. It's been causing more UV rays to reach the Earth than in the past. This is compounding the problem. And the relationship of intense and prolonged exposure to these rays and the production of cancer cells was first discovered when it was noted that there was a high incidence of cancer, particularly leukemia, among the people who pioneered studies of X-rays or who worked with radium and uranium. And then later it was found that survivors of atomic blast at Hiroshima and Nagasaki at the end of World War II had a high incidence of leukemia. So what does this mean for you in testing? Because I know probably no one cares about the history, but we want to make sure that you always be looking to promote a hat, and we're wearing a UV sun protection when people are out in the sun. We want to be able that they can get their skin checked by a doctor and make sure that they don't have any cancer areas beginning in places where they can't really see on their body. There is a genetic predisposition to some cancers. Research has revealed there's a genetic predisposition to certain cancers. There are now gene markers that they can find for colon cancer, breast cancer, prostate cancer, pancreas cancer, and leukemia. Breast cancer is more likely to occur in women who have a close female relative who has developed breast cancer before the age of 50 years. So we need to encourage maintenance of normal weight. Obesity is considered a risk factor in many cancers. It also makes early detection of many cancers difficult. They talk about nitrate and nitrite food additives, also known to be cancer stimulators to encourage cancer. There's actually been a couple studies. One noted that men and women who were overweight by 40% or more have a 33% greater risk of developing cancer. Some other research has come out that if foods containing nitrites are eaten in combination with foods with vitamin C, then they do not form the nitrosamines. So that means that if orange juice is consumed along with a meal containing bacon, that there is less chance of carcinogenic nitrosamines damaging your body. So vitamin C is actually a cancer inhibitor. Alcohol, moderation in the drinking of alcohol is recommended because we know that alcohol consumption alone increases the risk for several cancers. And we also know excessive alcohol consumption leads to liver damage and possibly to liver cancer. Something for you to think about as far as warning signs of cancer. If you list all the warning signs of cancer from your textbook and what we know, they spell a little, I guess you guys call this mnemonics, it spells caution up. So if you go down through here, C is changes in bowel or bladder habits. A sore that does not heal. U, unusual bleeding or discharge. T, thickening or lumped in the breast or elsewhere. I is indigestion or difficulty swallowing. O, obvious changes in warts or moles. N, nagging cough or persistent hoarseness. U, unexplained weight loss. Or P, pernicious anemia. Now, you can have these signs and not have cancer, but these are things you need to commit to long-term memory. And I talked to you guys about in pharmacology about how you do short-term memory. You don't remember. These are things you need to know forever, these signs and symptoms, because a patient will complain to you. You maybe take intake information on a patient somewhere, and they're having these signs and symptoms. They're going to kind of check them out to make sure there's no cancer. So you want to know, and they do ask you a lot of test questions, and they're not putting it in this cute little format. They kind of put it in kind of a vague, I tell you I've had unusual bleeding or discharge for a couple of months. Well, that's a warning sign that needs checked out. So you have to, sometimes we tell nurses you don't really diagnose. You kind of do just a little. I mean, you kind of sort of have to be thinking about what does this mean. If somebody has an obvious change in a wart or a mole, that would be indicative of having that checked out. Could that be a skin cancer? A sore that does not heal is also another big sign. Any change in bowel or bladder habits. So you kind of want to commit these for long-term memory and make sure that you understand why they're warning signs of cancer, and you need to know exactly what they are and be able to repeat them back. Biopsy is the removal of living cells for the purpose of examining them under a microscope. You can have a surgical excision where they cut something out to biopsy it. You can aspiration and have something where they actually use suction to pull out the sample that they want to look at. They can do what's called a frozen section. They can do a fine needle aspiration, and they have something called a percutaneous biopsy. A couple of tests that you might want to be familiar with is a CA-125. A CA-125 test measures the amount of the protein CA-125. It's an antigen for cancer in the blood, and the test may be used to monitor certain cancers during and after treatment. In some situations, the test may be used to look for early signs of ovarian cancer in people with a high risk. The second one is called prostate-specific antigen. Current recommendations include offering baseline for men at the age of 50 and repeated at various intervals depending on the patient's risk. So what antigen means that they can go into your blood and see the antigen that you're carrying that's trying to fight the cancer off, which if you think about that, that's pretty incredible science. The other test that I put on here was a CBC or a CBC with DIF. You should know that something in leukemia, they would be able to see that you had cancer. They would be able to see that in the CBC. And this is a Sanka thing for me, stuff that all nurses know. You need to commit your white blood cells and your platelets and your hemoglobin, and you need to put it in your long-term memory. I see some of you put it in your short-term memory, and then I bring it up later on a test. I don't know if you thought it would only be in cancer. It comes up in surgery. It comes up in other medical problems. You don't need to memorize every lab test, but definitely white blood cells, platelets, hemoglobin. There's some others along the way that you kind of pick up, kind of know what a normal measurement is, and what does it mean if they're not in the normal range. Another tumor marker level is called a CEA. It's a glycoprotein produced during fetal life, but not normally present after birth. Its production may resume again, however, and the CEA level can be increased by some kinds of liver disease, cigarette smoking, and especially in GI and colorectal cancers. And so it can be used as a tumor marker to evaluate the effectiveness of treatment because these levels usually fall within the normal range 1 month after your successful treatment of cancer. Some surgical terms that overlap from the surgery chapter. Obviously, biopsy means to obtain a specimen. Prophylactic means a preventative treatment. Explorative is when you determine the effectiveness of therapy. Palliative is to offer pain relief. Curative is to attempt to cure. And reconstructive is to reconstruct something. So, radiation therapy. They actually measure this in units. They call it the RAD, that's radiation absorbed dose. It's the unit that they use to measure it. The course of radiation is usually spread out over a period of days to weeks. And what the radiation does, it destroys the malignant cells without permanent damage to adjacent body tissue. So something I do want you to take note of, I've seen it a lot in test banks. It's something you should know. It doesn't happen a lot, but what's called internal radiation therapy. This involves introducing a radioactive element into the body. And this material can be administered in different ways. It can be in a sealed container and inserted into a body cavity at the site of the tumor or placed directly into the tumor. It can be administered in an unsealed form or taken orally or injected by syringe. The concern that I've seen, or the old school concern, was that something could become dislodged and you would go into a room and someone who was getting radiation and you would need to know what to do. First of all, let me give you an idea what to expect. A person who has this internal radiation, you're going to have to limit your time that you're in their room. The few people that I've had that had internal radiation, I mostly just set their tray down and kind of shoved their tray over to them, and then left the room, and they were expecting that. They're kind of warned ahead that the nurses cannot spend a lot of time in their room. And for your information, for future reference, you are exposed to radiation all the time from your lights in your house, and it's just not enough to make you sick. We don't want you in a room where someone has this internal radiation for a lengthy period of time. We also don't want this person's family in the room any longer than they have to, or children, or pregnant women. So be looking for those types of clues. The other concern would be if something would fall out on you. If something would happen to fall out on you, there's always a contact person from the department that does radiation to get a hold of, and there's usually a very kind of a funky kind of a lead-looking trash can that you could grab the tongs and throw something into it if you had to in an emergency. So you got to kind of keep in mind and take a really good look at that in your book, because the few times that you do see it, I want to make sure that you would have some idea what you needed to do. These patients who have these sealed implants, they're going to need a private room with a private bath. We usually put a sign on the door, caution radioactive material. The nurse will wear what's called a dosimeter film badge. They'll give you a little badge. They want to make sure that you don't get any overexposure to that patient's radioactive implant. Absolutely no pregnant women or any children cannot visit. Any visitor was going to have to stay at least 6 feet away from the patient and stay over near the door no more than 30 minutes a day. Never touch the radioactive source with your hands. You save all dressings and bed linen until radioactive source is removed. And remember, if you have to draw their blood's radioactive, and so is their urine. So you have to really, really be thinking about this when you give care for this patient. You can see why it's such a kind of a topic that you should really know and know well and put in your long-term memory. There are several types of chemotherapy. They go by the name anti-neoplastic agents, who actually decrease the number of malignant cells in the generalized malignancy, or they reduce the size of a localized tumor and thereby lessen the severity of symptoms. Or you can have cytotoxic agents. Those are poisonous to cells. However, normal cells do not reproduce in exactly the same way as malignant cells, so normal cells are able to repair themselves more rapidly and effectively. Steroids are often used in combination with these anti-neoplastic drugs for cancer treatment. They have several ways that they can administer the chemotherapy. They can put it in the artery, they can put it in your peritoneal area, intraventricular, they can put it within the space of the spine. They can do it via intravenous infusion. They use the term vesicants. Vesicants are chemicals that cause tissue damage upon direct contact. Can cause severe local injury if they escape from the vein into which they are administered. Chemo has to go through a port in your chest for that reason. I have seen patients for over many years tell me about complementary medications they use as therapies that they use in addition to, but not as a replacement for, their traditional Western medication. I certainly think we could have a good discussion in class about that rather than me doing that in a boring voiceover. I think you guys probably have heard what some patients use also in your life. You could in your practice, and could share some of that with the group. Okay, this is kind of important because they're going to be looking for you to understand this in test questions in your nursing care. Common problems related to cancer or cancer treatment. The first one is anorexia and malnutrition. People who are taking chemotherapy, who are nauseated and possibly vomiting, are going to start to lose weight. Okay, we want to plan ahead for this patient, and we can't make them eat, but a lot of times they'll be given some of these nutritional drinks that we have. They'll probably want to weigh them and see what their weight is, and maybe possibly daily. We want to kind of prevent the nausea and vomiting before they go to chemo and medicate them, pre-medicate them before you send them with medication so they're not nauseated. The other thing is they get what's called stomatitis, or here they call it mucositis in oral care. The stomatitis I'm talking about is not a stoma that comes out in your abdomen, which a lot of students think. A stoma is just a word for hole. What happens is the chemotherapy does not know, it kills off all the cells, including the good cells, and people go and they get sores in their mouth. They get that natural bacteria that regulates your mouth, dies off, and people say that they can barely swallow, their mouth gets so sore. So they need good oral care. We want to watch that weight loss and make sure there's not more than 2 pounds. Any weight loss of 2 or more pounds per week is something we want to look for. We want to be looking for the nausea, vomiting, and diarrhea. I have had these patients get constipation. Obviously, as nurses, we deal with that all the time with everybody. Cystitis is pain on urination. It happens. We want to go over here to the blood work, which is what I see a lot of you fall down on. You don't put your blood work into your long-term memory, so you don't even think about it. But what happens when you're on chemotherapy is you get immunosuppression and decreased white blood cells. Well, if I don't have enough white blood cells, I am going to get an opportunistic infection. So people who have cancer are at risk to get an infection. They don't have enough white blood cells. So if you don't know what the normal white blood cells are, you have no way to understand how to deal with that. If a patient has chemo, I will make you wear a mask when you go in there. If they have to come out of the room, I'll put a mask on them. This was way before COVID. This has been a practice long before that. Okay, and anemia is your hemoglobin. Your hemoglobin also drops off when you take certain chemotherapies. Well, remember what I need my hemoglobin for? I need it to carry my oxygen. I have anemia if I don't have enough hemoglobin. The other thing is bleeding problems with platelets. If I have enough platelets, what's going to happen? I actually scratched myself there the other day with some students. I don't even know where I scratched myself. Well, it had already had a hard little scab forming over it. That's my bleeding properties. They made a little scab there wherever I had hit my finger. Well, that's normal because I have a normal platelet level. But you're going to have to know the normal values and kind of be thinking about what these patients are dealing with. Okay. Hyperuricemia is too much uric acid. They can get kidney stones. They also have a lot of fatigue. Alopecia is when you lose your hair, and of course they're in pain. And some of you are just way off base when you talk about pain. You wait until the patient asks. If I have a patient who's getting cancer treatment, he doesn't have to ask. I usually go in and say, I'm going to get your pain stuff ready. Now, obviously, I don't push it on people, but I just go ahead and offer it and bring it in. I don't wait until their pain gets so severe. And I've seen you guys, a lot of you answer questions like that and tell the patient just to tough it out. This is not how we answer this question. I don't care what you've seen in your normal practice or what you've seen other nurses do. That is not what we're supposed to do. And remember, test questions are supposed to be what we're supposed to do, not what we're seeing done out in our practice, which sometimes isn't the right treatment.